facilities that are licensed nursing home facilities where we have been able to take proposals from and we've looked at done site visits to make sure that they can safely take care of patients who are diagnosed with COVID-19. They would be able to take those patients from the hospital as well as from emergency rooms or other nursing homes to allow us to safely take care of them, and at the same time keep those patients separate from the other nursing home patients where we have a couple thousand in our community, keep them from being exposed.
And how many total beds are you thinking you're going to need for this program? And are there, options like this being considered for other groups of people at this point, or could you see this program being expanded even to the general population?
So we currently are looking at 100 beds. One facility has 60 beds and the other would have 40. We're also, like most people, trying to look at if we end up needing more, what would our next steps be? And so we've been looking ahead at that as well. As far as other populations within our community, there are multiple different task forces that AATC EOC has looking at those different communities.
Are you aware, can you comment on what Austin Public Health is doing to address COVID-19 in the homeless community?
So I personally am in charge of the nursing home response and taking care of assisted living and independent living elderly, who are our most vulnerable with a potential mortality of 30%. We do have, though, multiple other task forces who are specifically looking at putting action plans together for the homeless.
Okay. And people are still very interested. I'm sorry, I should have mentioned that was Fox 7 question. And now from KVUE, people are still very interested in negative testing and people who aren't coming back positive. And yesterday we saw Hays County release that information. Can you give us an update on negative testing? Or are you aware of those figures?
So I don't have the current figures for negative testing. However, currently we are definitely prioritizing the nursing home residents for testing. Since, again, they're the most vulnerable of our population and because they live in institutional settings. So we have been focusing our energy on any time we have any concerns in a nursing home. That's taken very seriously up through the task force directly up to Austin Public Health, and testing is expedited.
Okay. And this next question from Community Impact. You mentioned 2 facilities. Can you tell us where those isolation facilities are going to be located?
So they're both licensed nursing facilities. One is in Travis County and one is in Williamson County.
Okay. And next question here from CBS Austin. Is moving to one of these isolation facilities in any way optional, or will all positive COVID-19 patients in nursing homes or assisted living facilities be required to move to those centers after they are released?
So all of decisions to admit to the COVID positive facility are done on an individual basis by both the facility medical director as well as an evaluation of each individual patient. In general, we will not, we're going to be preserving people's right to choice as much as possible, but balancing that with the public health, with our public health mandate to protect them as well.
Okay, and could you be any more specific on general areas in those 2 counties, or is there any kind of more hard information?
They're in very good locations within the county. I don't want to mention specifically because we want to give those facilities opportunities to notify their staff and make arrangements prior to being fully operational. But once it is operational, it will be public knowledge. We certainly don't want something like that to be kept a secret. Our nursing home task force is unique in having put in place those nursing facilities. We're being innovative in a way that we haven't seen in other communities. I certainly can't say that I've investigated other communities, but certainly we didn't see this happening in Washington or some of the other places we're hearing about. So we're very hopeful that by having these facilities up and running before we hit any sort of surge population, that we will be able to really protect our residents better than other communities have perhaps been able to.
And this next question from KXAN, is there enough available qualified staff to operate the new isolation sites, and where will that staffing come from? Also, is there any increased training, any other safety protocol that is going to be in place that wasn't before?
So we will be using all licensed staff and allowing the facilities to run as they do. So just as a skilled nursing facility currently is regulated by Health and Human Services and has strict infection control policies, all of those would still be in place. We would have the same staff. There would be some restrictions. Staff that work in one of these facilities would not be allowed to go into another facility. And in general, we're looking at how to be fair for the staff, and we're leaving that to the operators of those nursing facilities to decide things like compensation, et cetera. The county and the city are also providing personal protective equipment, as well as other needed items as we're able to.
Okay. Can you describe the protocol in terms of transparency as it relates to identifying sources of the coronavirus and the decision not to alert the public of those sites and where that's coming from?
So, Austin Public Health is always balancing, especially as physicians involved with that, and balancing the patient's individual privacy healthcare rights with the public's public health need to know as well. And it's an ongoing decision. And I know Dr. Mark Escott and all of the people at Austin Public Health are regularly figuring out what that balance is, and it changes daily.
Okay. And this one from the Statesman again. What sort of facilities are being used, particularly for this site, but moving forward, are you looking at using private rooms like hotels, maybe dorms, maybe large open spaces like the convention center to house people? So the Nursing Facility Task Force is specifically looking at skilled nursing level of care beds. So we're talking about patients who are not able to be housed in other areas that they need ongoing health care, whether they be discharged from hospitals or living in an existing nursing home. For those, we're really trying to focus on licensed facilities. We may at some point end up looking at accelerating the license of facilities that aren't quite open yet. However, I can tell you that many of the other task forces are actively looking at things such as you mentioned, hotels, et cetera, for people who don't require ongoing or don't have significant medical needs. But again, I'm focused on the nursing home side, and we're trying to keep our nursing home needs within an actual licensed nursing facility. And this next question from KVUE. Can you provide current information on hospitalizations, how many there are, and maybe how that number is informing your decision on these new beds? I don't have the exact number. I can say that our hospitalizations are still at a modest level. We certainly haven't seen a surge. However, we've been informed from models coming out of University of Texas, as well as UT Dell Medical School, to expect a significant increase in hospitalized patients. And with that, we need to have not just a place in our hospitals, but also where would those patients go when they're ready to leave the hospital. A certain percentage of them will not be able to go home right away for lots of reasons, and again, being able to provide a safe place where they can get ongoing medical needs. And so part of what our task force has built in these and is putting up these 2 operational nursing facilities will also help our hospitals and help prevent our hospitals from being overwhelmed. And this next question from Community Impact. Has this strategy of creating isolation facilities been effective in slowing the spread of the virus in nursing homes anywhere else that you're aware of? To my knowledge, we are being innovative in coming up with this as an alternate solution. We are using all of the tactics that we have seen done in other communities, such as Washington State, and what we're learning. It's an ongoing, rapid knowledge acquisition, and we're putting all those things in place as well. So protocols and isolation. This is just over and above a next step that we're adding in our community, which we very much hope will help protect our elderly patients. Again, what we saw up in Washington out of that one facility was 35 people died. And again, rates 30%, some would even say a little higher. And we
we absolutely want and need to avoid that in our community, if at all possible.
Okay, and next from CBS Austin, could moving a vulnerable patient to a facility with other sick patients adversely impact the recovery of the people who go to these facilities?
Can you say the question again?
So could could moving a vulnerable patient into a facility like this, surrounded by others who are sick, could that make their recovery more difficult?
Actually, we're hoping it would be quite the opposite. So we would be putting people who are sick with the same thing. So it's not that they're going to be at risk from getting some other disease. Again, this would be for COVID positive patients. We're also hoping that by being able to cohort, we can help preserve our personal protective equipment, so not have to use quite as much. But the other thing is that we're going to have special nurses, and we'll have special nurse practitioner and physician who are dedicated to that group of people who should know, and we will be informing them of best practices specifically for COVID-19 recovery. So it'd be one of those situations where if you or your mother or grandmother has COVID-19, and you would want them to be cared for in that facility, because that's where people who know how to take care of those patients would be.
And next from KXAN, are the nursing home employees who worked with the infected patients being tested now or monitored?
So, of the ones that have been tested that are currently in the hospital? Yes. We have a very, very robust response where we have sent in actually something called the IDRU, which is an infectious disease response unit, similar to something used in the Ebola, put together back when we were looking at Ebola, and that has gone into the nursing home and done both testing as well as recommendations and stabilized the situation.
And from patch.com, what are some of the sorts of constraints involved in not alerting the public to specific locations where COVID-19 is found? Could you just go over again the balance between that privacy and transparency as it relates to the protocol?
I would like to suggest that the public just assumes it's everywhere at this point. I think that we're getting to that. If you look at what's on, Austin Public Health has certainly said that we're at phase 5, where there's person-to-person transmission within the community. That's also why we have the current health authority orders and orders from the governor. As far as being able to say at specific places, again, it's pretty much in all communities across our county. And so it's important that people expect that and protect themselves. Again, trying to minimize the risk, not just for them, but also of getting our frail older patients exposed inadvertently.
A couple of questions from me.
Sure, and so we right now have 2 people that we're considering for this. How quickly do you expect it to spread? Do you think that we're going to see this ramped up in a matter of days, weeks?
My hope is that they stay nice and empty, but what I expect to happen is that within 1 to 2 or even 3 weeks, we will see them with significant numbers of patients based on the mathematical models that we've seen come out, again, of UT Dell and UT Austin.
And are you seeing any different or any changing characteristics as this continues, especially in our vulnerable populations? Are they becoming more susceptible? Are they getting sicker? Are they getting better? What's going on?
Luckily, we have not had any of our nursing facility residents we haven't had a significant number, so I can't say specifically in our community. However, the indication is that it is still very, very serious. There's really no reason to expect that we would not have the same mortality, again, 30% mortality in nursing facilities here that they had just weeks ago in Washington State.
And is there anything that you'd want to add, or any more information you think is critical for the public to know as we move forward in this process?
I would just like to remind everybody again how dangerous COVID-19 can be for frail older adults. We do have our nursing home task force, but what we're really asking from all the public is that you continue to isolate yourself and stay safe, as much for yourself, but as for our frail geriatric patients in our community.
You've been listening to a press conference from Dr. Liam Fry, the leader of Austin Public Health Task Force for Nursing Homes, and we wanted to give you some of the takeaways because we think this is really important to share with your family. Austin Public Health is setting up sites where people who live in nursing homes can be housed if they get COVID-19, but they do not need to be hospitalized. These will be isolation facilities, and they will feature about 100 beds where patients who are sick with COVID-19 can recover and stay separate from healthy patients. Right now, they aren't telling us the names of these facilities, but we do know one is located in Travis County, another in Williamson County. One of the facilities is said to have 60 beds, the other facility 40 beds. This all coming after 2 nursing home residents tested positive for COVID-19 last week. And what we do know from the nationwide perspective is that people aged 65 and older make up 45% of the hospitalizations and 80% of the COVID-19 deaths. 10% of the Austin Travis County population, that's 132,000 people, fall into this at-risk age group. And so the Department of Health is urging people to really pay attention and to listen to these orders that they've been giving, to ask people to shelter in place, to not go out into public places so that we can protect the older community. They do expect, we right now have these 2 nursing home patients who have been tested positive. They expect a significant number of patients to increase in the next 2 to 3 weeks. In Washington State, where this happened in the nursing home facilities, 30% of the people in those nursing home facilities that did come down with COVID-19 ended up passing away. So again, Austin trying to be proactive by setting up these facilities, again featuring 100 beds, so that people can recover once they do have COVID-19. We'll continue to keep you updated here on KVUE and KVUE.com, as well as all of our social media channels. And please continue to send your questions and your concerns and even some of your great stories to us here at KVUE. We appreciate it. Stay home, stay safe, stay lives. We'll see you soon.